I want to talk to you about something simple, something you do every single day, yet it has more power over your prostate health than most people ever realize. And that's the way you drink water. You've heard people say, drink more water, but almost no one explains how the timing, the rhythm, and even the spacing of your water intake can directly affect your prostate, your nighttime bathroom trips, and that frustrating urine dribble that so many men start experiencing after 50 or 60. So today, I want to show you a better way, an easier way, that supports a calmer, healthier prostate and gives your bladder the chance to work the way it's meant to. And the best part is that you can start doing this immediately, without buying anything and without changing your whole lifestyle. Before we dive in, let me ask you a question. How many times do you get up at night to pee? Be honest. Is it once, twice, maybe 3 or more? Tell me in the comments below because I want you to see how many other men are dealing with the same thing. You are not alone, and there is nothing to be embarrassed about. The more we talk openly, the better we all get. Now let me speak to you directly and clearly. The way you drink water truly matters. I've spent years helping men with prostate and bladder issues, and I've seen a consistent pattern. Too many men try to solve their urinary symptoms by cutting water out of their day entirely. They think, if I drink less, I'll pee less. But the body doesn't work that way. When you drink too little, your urine becomes concentrated, irritating your bladder and prostate even more. That irritation triggers more urgency, more frequency, and yes, more dribbling. So the goal isn't to drink less water. It's to drink water the right way. Let's start with the first change I want you to make. Drink most of your water earlier in the day. Your prostate and bladder are not fans of big gulps of water late at night. When you drink large amounts after dinner, you force your bladder to keep working long after it wants to wind down. You can think of your bladder like a muscle that gets tired just like any other muscle. If it's forced to stay active late into the night, you're going to wake up multiple times to pee. By shifting most of your hydration to the morning and early afternoon, you allow your bladder to relax as the evening approaches. This alone can make a huge difference for men who wake up to pee more than once per night. Here's how I want you to do it. When you wake up, drink a full glass of water within the first 30 to 60 minutes. Your body is slightly dehydrated from the night before, and giving it water early helps your bladder function smoothly throughout the day. Then, drink small, steady amounts every hour or so until around 4 p.m. After that, begin tapering your intake. You don't have to stop water completely in the evening, just reduce the amount. Instead of drinking a full glass at 7 p.m., take small sips. This gentle tapering tells your bladder, we're slowing down now, and reduces nighttime urgency. The next part of this method is equally important. Avoid chugging large amounts of water all at once. When you drink a full bottle quickly, it sends a surge through your kidneys and lands in your bladder faster than your body can comfortably handle. That sudden rush makes your bladder contract, which increases urgency and can lead to leakage or difficulty fully emptying. Instead, take smaller, evenly spaced sips. Think of hydration as a slow drip, not a flood. When you keep your intake consistent, you support a calmer bladder and put less pressure on the prostate. Another point I want to emphasize is the temperature of the water. You might find this surprising, but very cold water can sometimes irritate the bladder in sensitive individuals. I'm not saying you can never enjoy cold water, but if you notice urgency after drinking ice-cold beverages, try switching to cool or room temperature water. For many men, this simple adjustment reduces that sudden need to rush to the bathroom. Now let's talk about something many people overlook, bladder training. This is not about forcing yourself to hold it for long periods. That's not healthy. Instead, think of it as teaching your bladder to work more efficiently with water rather than reacting to every little urge. When you drink water slowly throughout the day, your bladder gets used to steady volumes instead of being shocked by sudden intake. This improves bladder control and reduces dribble after urination. Speaking of dribble, I want to address it directly. That small, frustrating leak after you think you're finished peeing is extremely common in men over 60. It can happen when the muscles and valves that control the flow of urine weaken slightly with age. The right water drinking pattern helps because it reduces irritation and inflammation, which is often a trigger for incomplete emptying. But there's also a simple technique you can start using today. After you finish urinating, pause for a few seconds. Don't rush, then gently shift your weight forward or give a light press just behind the scrotum. This helps release any remaining drops. It's subtle, but over time, it trains your body to empty more completely. Now I want to explain why drinking too little water can make prostate symptoms feel worse. When your urine is concentrated, it becomes more acidic and irritates your bladder lining. That irritation sends false alarms to your brain that you need to urinate even when your bladder isn't full. So you feel urgency at inconvenient times, and you may even wake up at night because your bladder reacts to that irritation. Hydrated urine is more diluted and gentler, which reduces irritation signals and keeps your urinary system calmer throughout the day. Another thing I want you to be aware of is caffeine timing. I'm not telling you to give up your morning coffee, but caffeine is a natural bladder stimulant, so it increases urgency and frequency. If you drink coffee or tea late in the day, especially after 3 p.m., it can disrupt your evening and nighttime bladder function. Shift your caffeinated drinks earlier and avoid pairing them with large amounts of water late at night. Your bladder will thank you. Let's talk about alcohol for a moment. Again, I'm not here to tell you to stop enjoying life, but alcohol acts as a diuretic, meaning it increases urine production. If you drink alcohol in the evening, especially in larger amounts, you'll likely end up waking at night to pee. And if your prostate is already a little swollen or sensitive, the combination of alcohol and late-night fluid creates even more pressure. If you enjoy alcohol, keep it moderate and try to avoid drinking it right before bedtime. Space it out earlier in the evening with food and water. Now I want to discuss something deeply connected to hydration: inflammation. A lot of men don't realize that dehydration can trigger inflammation in the body, including the prostate area. When you drink steady, adequate water during the day, you help your body regulate temperature, flush out irritants, and support normal blood flow to the pelvic region. All of this contributes to a calmer prostate environment. Again, this is not a magic cure, but these small habits support the natural healing and functioning of your body. Let me explain another subtle but powerful effect of drinking water the right way, the way it helps your pelvic floor. Your pelvic floor is a group of muscles that support your bladder, prostate, and lower organs. When you're dehydrated and irritated, you tend to tighten these muscles unconsciously. Tension in the pelvic floor can actually worsen urinary symptoms. When your hydration is steady and your bladder is less reactive, your pelvic muscles relax naturally. Hesitation, dribble, and pressure all become more manageable when the pelvic floor isn't constantly clenched. Now I want to walk you through what a balanced day looks like when you drink water the healthy way. In the morning, you give yourself a good start with a full glass of water. Through late morning and early afternoon, you maintain a calm rhythm. Sip steadily, don't flood your bladder, and give your body exactly what it needs. After 4 p.m., you gently reduce your intake, switching from full glasses to slow, intentional sips. This prepares your bladder for nighttime rest. In the evening, you avoid big drinks, limit caffeine and alcohol, and let your system slow down naturally. When you follow this pattern, your bladder begins to sync with a predictable, healthy cycle. Over a few days or weeks, many men notice fewer bathroom trips at night, less urgency, and better control. I want to talk to you for a moment from the heart. The reason I make videos like this is because I know how frustrating these symptoms can be. I talk to men all the time who feel embarrassed, discouraged, or even scared when they start having urinary problems. I want you to know this: these symptoms are common, they are manageable, and you are not powerless. You don't have to accept a life of running to the bathroom or feeling uncomfortable. Small, consistent changes truly add up. Another thing I often tell my patients is this: hydration is only one part of the journey, but it's a powerful one. When you learn to work with your body instead of against it, everything becomes easier. Your bladder becomes calmer, your nights become quieter, your confidence grows. And again, none of this is about extreme restrictions or complicated routines. It's simply about aligning your habits with the way your body naturally wants to function. Now, let me give you one more practical tip you can use today. Pay attention to the color of your urine. You don't need to obsess over it, but it's a simple indicator of whether your hydration is supporting or irritating your urinary system. Pale yellow means you're in a good place. Dark yellow or amber means you need more water throughout the day. Clear urine can mean you're overhydrating or drinking too much too fast. Your goal is balance, not too much, not too little. Let me also address exercise briefly. When you're physically active, even lightly, your body processes water more efficiently. Something as simple as walking 20 to 30 minutes a day improves blood flow to the pelvis and supports a healthier bladder and prostate. This helps your body use water in a more stable, predictable way. And that means fewer interruptions, fewer nighttime trips, and better control. You may be wondering, how long does it take to notice improvement? Everyone's body is different, but many men feel changes within the first few days. Some feel it in a week or two. The key is consistency. Drink water with intention. Space it out. Shift it earlier. Taper it later. And stay patient with yourself. This is about long-term support, not quick fixes. Before I wrap up, I want to remind you of one more important point. Urinary symptoms can have many causes. While hydration plays a big role, it's still essential to talk to a healthcare professional if your symptoms worsen or if anything feels unusual. This script is meant to give you practical lifestyle guidance, not diagnose, treat, or replace personalized medical care. Your health always deserves proper attention and expert evaluation. But please remember this: you have more control over your prostate and bladder comfort than you think. And sometimes the smallest changes create the biggest relief. So here's what I want you to try starting tomorrow morning. Drink a full glass of water shortly after waking up, sip gradually through the day, taper after 4 p.m., avoid chugging at night, and listen to your body. Try this pattern consistently for 1 week and pay attention to how your nights feel. Track your bathroom trips, track your urgency, track how your body responds. You deserve comfort, you deserve rest, and these habits are simple, free, and supportive. If this video helps you or if you want more guidance like this, make sure you leave a comment because I'd love to hear your experience. And if you're dealing with these symptoms right now, please know this. You're not alone, you're not broken, and you absolutely can feel better. Take care of yourself. You're worth the effort. Urologists, drink water. This way to shrink your prostate and fix urine dribble. After 60.